Okay, loading. All right. Hello, everyone. Happy Tuesday. Today is a special day for two reasons. Number one, Trendy Tuesday, of course. And also today's National Doctors Day. And I'm joined by the lovely Dr. Sophia Yen, who also has her MPH, but also is an MD. So shout out to all of the doctors, not only on the Pandia team, but also all of the doctors out there, especially those who are frontlines, pandemic. It's been a rough time, and I feel like now more than ever, we can really appreciate our medical professionals and just be grateful for all of the important work that they do. So thank you, Dr. Yen, and thank you to everyone else who's out there, and not even just the doctors, but just all medical professionals, frontline workers. It is very much appreciated, all of the work that you do. So that is the perfect topic, because tonight our main discussion is going to be about birth control and its reaction with other medications. So we're going to talk about a bunch of different medications. We had a previous live on mental health, so we're going to kind of skip that. Maybe we'll touch upon it a little bit, but we're going to talk about cold medicine, flu medicine, marijuana, all that good stuff. So without further ado, let's get started, and I'll mention all of our social media and that at the end, so stay tuned. First question for tonight is, how is birth control, or is birth control impacted by, we'll go through the following medications. Let's talk about cold medicine, flu medicine, and allergy medicine in the heat of allergy season. If you could touch on all those, that would be great.
All right. Let's start with flu medicine. And I would say flu is generally you're treating the symptoms. So you're taking Tylenol, ibuprofen, muscle pain, you're taking antihistamines. All of these things are fine. No interaction with your oral contraceptive pill, patch, ring, IUD, implant. No problem at all. The problem comes when they put in one over-the-counter drug, which I believe is pseudoephedrine. So if you hear the word Sudafed, or if you look at the list of ingredients, because sometimes, like with NyQuil, they have like 6 or 12 ingredients in there. If you see pseudoephedrine, the problem with this medication, I love it. It works really well, but it revs up your liver. And so then it chews through your birth control faster, because your liver's job is to detoxify all the drugs. And so it will just speed up and eat all the drugs, because you gave it 7 different drugs, and then it starts eating up your birth control, and then your birth control won't work. And so my joke is, as long as I take my birth control, I don't bleed. But when I have allergies or it's cold season, I have to choose, do I bleed or do I breathe? And so if I'm taking Sudafed, I can breathe, but then I will bleed, and I don't really like to bleed. So it's a choice you have to make. But on the flip side, if you're bleeding and you're taking your medicines, you shouldn't be bleeding, that's an indicator that your birth control is not working. So if you're taking Sudafed, you may want to use a backup method, or you may want to avoid methods with Sudafed, but Sudafed is a really effective drug when you need it for nasal congestion, runniness, or allergies. Like before I was a doctor, I was taking a medication, and I later looked at it and it was Sudafed. And that is not an antihistamine. It's not treating the cause. It's just treating the symptom. But it worked really well for many years of my life. So that is flu. And then the same thing with the cold. And then with allergies, you also take nasal steroids. And so nasal steroids that you squirt up your nose, no effect whatsoever on your birth control options, birth control methods. And again, if you're taking Sudafed, then that's a problem. If you're taking an antihistamine, no problem whatsoever. But in general, just as my Pandia public service announcement for the day, if you are having bad, evil allergies, and most of us are in California and actually throughout the country, then it is often the nose. You can probably hear it in my voice. It's a little different today. And if you do nasal steroids, that is the best treatment, because you're treating the location. And what you're doing is you're telling the cells that are like, there's pollen, and they're actually treating it like an outsider and throwing mucus and stopping it from getting into the body, but you're suffocating and all congested in the meantime. And meanwhile, you got sinuses swollen up and kind of painful. If you give it the steroid, you're like, hey, just ignore that. Don't stop having a hissy fit. Stop releasing these histamines. And then the antihistamines just treats the histamines that have been released, but it doesn't treat all the other things that these white cells in your body are having an allergic reaction. So our tip for today, TLDR, nasal allergies, runny nose, sneeziness, use nasal steroids. And I know it's hard for people, but the other tip I learned from the allergist, because I have such bad allergies, is when you're doing the nasal steroids, tilt its nose to the toes. So not like this, squirt, squirt, but nose to the toes. And then aim towards the center. And then you blow out your nose of all the snot. Because if you squirt it on the snot, not going to be useful. You want to squirt it on the mucous membrane. You want to exhale. And then you want to start, and then squirt it while you're inhaling to suck it as far possible in. And then I do it right before I go to bed, because then you're like this. And then all the medicine can then go into your sinuses. And it actually has been shown to work for your eyes too, because I get crazy allergic, itchy eyes. And the antihistamine drops are really expensive and not covered even by the best of insurance, like $150 a month or something horrible like that. So the nasal steroids is a good way to get down your need for that. And know that Visine, oftentimes, you have to look at the ingredients, but a lot of them is just constricting the blood vessels. So yeah, you may look at my eyes and they may be a little bloodshot. It's not marijuana, it's allergies. But it'll constrict it, but then after 4 hours or when it wears off, it'll come back. So it's really just cosmetic. It isn't treating the problem. But some of them do have antihistamines, and those ones are good.
Gotcha. Yeah, I was going to say Visine never worked for me. It's a temporary fix, but it's, as you mentioned, after 4 hours, it goes away. And if you're at work all day, that's kind of, you don't want to be like in the office. So no, that's a really good thing to keep in mind. And where can you purchase these nasal steroids?
Oh, so it used to be prescription only, and now it's over the counter. So you can go to Costco and they have the name brand or they have the generic. I'm a cheapo. I use the generic and it works fine.
Okay. Oh, good to know. Yeah, and that tilt head forward, that's so funny. I feel like everyone is like, tilt your head back, but I feel like that's worse for the feeling. If you can do it, great, but.
No, nose to the toes, and then this, and then exhale and breathe in, and then tilt your head back to get it all in as far as you can.
Okay. Cool. All right. Allergy season pro tip. I love it. So next, you mentioned it already, marijuana. So if you smoke marijuana, and I guess we can go into all of the forms, smoking or edibles, any of that, how or if can that affect your birth control?
That should have no effect whatsoever on your birth control, except you forget to take your pill, you forget to use a condom, you forget to put in your ring or whatever. So that is the main risk of using marijuana. I think people confuse it because they know with smoking and birth control, there's a risk. And what that is smoking tobacco. And it's because with tobacco, you have a greater risk of blood clots, heart attacks, and strokes. And then you add on the risk from the estrogen and the birth control. And so the two together increases your risk. But marijuana does not have that risk. And particularly if you eat it, it definitely doesn't have that risk. And if you smoke it also as well, it's just a different mechanism of the drugs that are in marijuana versus tobacco. So marijuana poses no risk whatsoever that we know of to interact with your birth control.
Okay, good to know. Yeah. And if you are choosing to smoke marijuana, definitely be careful with where you get it and make sure that it's not laced with anything. Have, a safe provider if you're not growing it yourself. I know that is a thing that a lot of people do in DC now that it's legal. But yes, be very careful. But good to know. It doesn't affect your birth control, but could affect your brain. So be careful if you are taking it. Cool. So that kind of brings us into our final main question, which is, are there any other drugs? We can talk about recreational drugs, so like the party drugs, like, I'll be honest, I can't even think of any off the top of my head. Like Molly, I don't know.
Ecstasy. Yeah.
As you can tell, I'm not familiar with the drugs really. But we could talk about anything else as well that comes to mind in terms of anything that could impact your birth control. Or your brain, don't forget.
Well, I think, for people to know that pseudoephedrine is behind the counter, you have to show your ID because you can make methamphetamine with it. And the whole reason is it speeds up things. And so it revs up your liver and eats through the medication. So if pseudoephedrine can mess up your birth control, then methamphetamine probably can mess up your birth control, and any kind of upper kind of drugs. I'm not so sure with the downer kind of drugs. I'd have to look at that specifically because, again, everything has to go through your liver. And if your liver has to detoxify whatever drugs you're using, then it may be revved up and eat through your birth control. So if it's like a one-time deal, you're probably fine. If it's like every single day for 5 days or forever, then your liver may be activated and eating through your birth control sooner rather than later. And so please, if you're on any of these things, talk to your doctor. On the last call, she had a great question, which is, if your doctor hears you're doing something illegal, do they have to report it? And to my knowledge, we do not have to report anything illegal as long as you are not harming someone else. Like, I'm going to go kill somebody, I'm this crazy. Or you're harming yourself. I'm going to kill myself because I'm so depressed or something like that. But we, to my knowledge, are not legally mandated to report anybody using any illegal drugs. We are mandated if anybody's being sexually abused or anybody's being beaten for minors. For adults, we actually have to ask their permission. So I think it's patient-doctor confidentiality.
Sure. Okay. That is really interesting. I always assumed, because of the mandated reporter thing, that would apply to drugs as well. But that's really interesting. So yeah, if you are concerned, you can talk to your doctor. And please do. In fact, they will probably know better than another person just randomly. So yeah, good things to do. And this actually reminded me of another question. So what about medication that's used for digestion? So this, I just think specifically for myself, in meeting with a GI doctor semi-regularly, we were talking about how the medication that I could take, they didn't know specifically if it could impact birth control. So there's like the over-the-counter medications like IV Guard, which has been really helpful to me, and the fiber pills, all that good stuff. And there's also prescription medication. There's the dicyclamine. Clearly, I have a lot of digestion problems. Do you happen to know anything about that, and if that can affect your birth control, or maybe if birth control can ease the stomach aches, or if there's any relationship with that and digestion?
Yes. So I would say any over-the-counter antacid should be okay. There's a theoretical risk with magnesium, like I think 10, 20 years ago, but I think I just checked on it to see, because I noticed a lot of people were not mentioning it. And I was like, that's because I know better. But it seems that they've kind of let that go. But certainly if you're taking anything with magnesium, maybe take it at a different time of day. A lot of antacids are calcium carbonate based, and that's totally fine. It's just this theoretical magnesium thing from a long time ago, and it doesn't seem to be, as emphasized currently. Every prescription drug you need to check with your doctor, but in general, I know the categories of the no and the no and the no, and mainly it's the risk of blood clot and it not working. And GI drugs are not on that list. The main categories of drugs are antibiotics, and even then, it's only 2 specific drugs. It is griseofulvin, which is to treat like fungal fingernail infection or toenail infections, or fungal infections of the hair and the skin of your head. So if you don't have those issues, you probably aren't on griseofulvin. And then the other one is a tuberculosis drug called rifampin. So if you don't have tuberculosis, you're probably not on rifampin. The other ones are all theoretical, and I always like a disclaimer. Every single person is different. And if you kill the gut bacteria, they're involved in what they call a gastrohepatic circulation of the hormones or whatnot. But in terms of research, the research has shown that any of the antibiotics are fine, except for griseofulvin and rifampin. The other category of drugs is seizure disorder. So if you have a seizure disorder, there are so many seizure different drugs, and like 9 of them have an interaction with the birth control pill. Some of them make the birth control pill patch ring less effective. Some of them, the birth control pill revs up the liver and makes the seizure med less effective. So you're more likely to have seizures. So actually that's a common one we see that people are using for anxiety or stress. I think it's like lamotrigine or something like that. Mm-hmm. And if you're using it for that, then just a heads up, you're going to need a little more medicine. But if you're using it for seizures, it's really important that heads up, you're going to need a little more medicine, because we don't want you having a seizure. So those are the main categories. And then St. John's wort is an over-the-counter antidepressant treatment that decreases your birth control efficacy. So if we don't prescribe birth control with St. John's wort because of that, because you're going to mess up the efficacy of the birth control pill, but it may be okay with the ring or the patch, or we just in general get a standard antidepressant, which shouldn't have interactions with your birth control. And then with respect again to GI, we all know that 30% of women have GI problems with their periods. And so we're always about sharing, making #periods optional. And if you're new to us, please go to pandiahealth.com/periods optional. On the bottom is my TEDx talk on the science and safety of fewer periods. So if every time you get your period, I get like diarrhea, other people get constipation, other people get other stuff, and it's 1 in 3. And I think we, as those who bear uteruses, need to stop sucking it up and start complaining about the things that we have, so that people know, so that we're not alone. It's so reassuring to be like, am I the weirdo that just, have these problems? Or no, you're not alone. And that's just so reassuring.
No, it's very true. And it's actually pretty easy to skip your period. Just 2 things to note. The first one is that if you are not on birth control and you're not getting a period, that's different. Talk to your doctor about that. That could mean extra stress, weight loss, other health conditions. So
pregnancy.
Exactly. So what we're talking about is actively making your period optional, which is so cool, taking your reproductive health into your own hands. And a couple ways you can do this. Well, the main way is essentially when you're on the birth control pill specifically, you can just not take the placebo week. So usually at the end of the pack, there's either 4 to 7, depending on which one you're on, and you just don't take those. You go right into the next pack. And I feel like I remember you said you can also ask your doctor to prescribe packs that don't have that last week, so you don't even need to worry about it.
Yes. So there are, it depends which one you're on, and some of them just have 3 weeks of active pills, and they expect you to remember that last week. I think in general, it's good to take a pill every day so you don't forget, but not having it is perfect because you just keep taking the pills. There's also packs of 3 months at a time, but I don't think those are necessarily the best ones. If it were me, my daughter, my friend, my patient, I would prescribe those because some of those have more side effects. But it depends each person, and it depends what dose you're on. So I've actually learned that at a high standard dose, 30 micrograms, they pair it with a high progesterone. But then at the 20 microgram, when you're 30 or older, it's a lower progesterone. And that lower dose is actually fewer side effects, obviously. And so these bad side effects that I fear at 30 micrograms aren't as much of a problem at 20 micrograms, but still, I think, are not as good as the one that we usually like to put people on.
Gotcha. Yeah, that makes sense. And there's so many different types of birth controls. And is it 8 or 9 different progesterones?
I believe there's 8, but close enough.
8 sounds right. There's a lot. So 40 different types and then 8 different progesterone. So there's so many different ones, and it's pretty easy to switch it up for the most part if you're working with an OBGYN or even a primary care physician. If you say like, hey, I really don't like my birth control, it's really easy to just get a new prescription, and it might take a while to find your perfect match, but we also recommend the IUD as a great method for people who are not interested in having children in the foreseeable future or ever.
I would recommend the IUD with hormone.
Yes.
I think it's really important because so many people are anti-hormone now, and then they're going to the copper IUD, and then they come back and they're like, oh, so much blood. Oh, so much cramps. I was like, did nobody tell you the top 2 side effects before they put the copper IUD in you? I'm sure they did, but they're like, oh, not going to happen to me. But the top 2 side effects, more blood, more cramps on the copper IUD. On the hormonal IUD, magical. 70% of the women lighter periods or no periods, and then 30% lighter periods. So great benefit to everyone. The only negative is with the current, and we hope there will be innovators out there. IUD only has 1 of the 8 progesterones. So if you don't like that progesterone, you have no other options with the IUDs.
Gotcha. I know, sad, but fingers crossed. Maybe we'll find some other methods. I feel like technology is ramping up, especially in the women's health department. So engineers who are interested in women's health, get on that. Yeah, that's really awesome. But if the IUD doesn't work out for you and you want more of that method versus the pill, there's also the patch, the ring, the implant, which goes in your arm.
Yes.
There's probably more.
There's a shot, but we usually don't recommend it because you have to like shots and you have to come in every 3 months, or you could self-administer at home. There is a depot sub-Q, or if you're a nurse or, a health person, we'll let you do that as well, given COVID.
Gotcha. Oh, that makes sense. Okay. Wow. But yeah, there's a lot of different types out there, long story short, so you can test the waters. And it's pretty exciting. I know it can be a scary thing to be putting things into your body, but at the same time, when you know that you can change it up and it's so easy to just stop, it's not like other medications where you have to wean off. I mean, the IUD, you have to get it removed. But otherwise, it's okay to stop if you don't like it and talk to your doctor. So having that strong relationship is really good. Yeah, so that's pretty much it. Did you have anything that you would like to kind of recap from this conversation? I know we talked about a lot of things.
Yeah, so I guess my summary would be that the drugs to watch out for that you should talk to your doctor are any seizure medications. The antibiotics, the research has only shown 2 antibiotics to truly have an effect, and most people are never on these drugs, griseofulvin and rifampin, maybe in third world countries, or maybe near Mexico border, because they do have tuberculosis there in the old days, and it may be better now. But in general, theoretically, the antibiotics should be fine. But if it were me and just being safe and not wanting to be pregnant, I'd also use a condom just to be safe while you're on an antibiotic. And someone asked a good question. The last one is, do you stop it once you stop the antibiotics, or do you give it an extra week? And again, to be safe, I would give it an extra week, because it always takes about a week for things to get up to the right level. And then, as you mentioned, Sarah, that was brilliant, is that we want people to always know that there's 40 different birth control pills. If you didn't like one, there's 39 others, but at the very least, there's 8 progesterones. Know which the progesterone that you don't like, and know the dose, and tell the doctor, and then the doctor can try 7 other ones. Extra pearl in their Pandia public service announcement is that give every method at least 6 weeks, ideally 3 months, to see how it goes, because your body has to get used to it. And you can't just be like, I tried it for 3 days, it made me nauseous, I give up. You didn't try it, you just gave up. And so we need you to at least, give it 3 to 6 weeks. Don't just give up after a couple days. And for nausea, Google Pandia Health, Dr. Yen's tips first time on birth control, which is don't take it first thing in the morning on an empty stomach. The worst. Take it right before you go to bed. I've only had 2 patients in my 20 plus years wake up with nausea, and they were scrawny little girls, so we just decreased their estrogen. And then the other one is take it with the largest meal of the day. So for a lot of Americans, it's dinner. Ideally, it should be breakfast, but whatever your largest meal of the day, after you've eaten all that food, throw down the pill, and there should be less nausea.
It's mixed in. Yes, exactly. Awesome. So those were all such great tips. Thank you so much. A couple other things to mention. Follow us on social media. We're at Pandia Health on everything: Facebook, Twitter, LinkedIn, Instagram. We even have a what is that called? Pinterest page. Yes. So it's like I can't think of what it's called. Pinterest. Oh, and we're on YouTube too.
Yes, so, TikTok.
Yes. Oh, and TikTok. We have Nina and Ariana and Ivo making amazing TikToks. So check that out. Fun, relatable period stories. Yeah. So that is pretty much it. Again, happy National Doctors Day to all of our medical workers. We appreciate you. We hear you. It's been a tough time, but if you love what you do, that's amazing. Other than that, we will see you all next Tuesday, same time, with a different fun topic. And have a great evening.
Have a great evening.
Yay.